Ready or not, flu season will be back, and it could be a 1-2 punch with a potentially severe swine flu outbreak. The Obama team was out in full force today, promoting ways companies can keep their employees healthy. New guidelines were released today by the Department of Health and Human Services. HHS Secretary Kathleen Sebelius joins us now from Washington, along with Commerce Secretary Gary Locke. Thank you so much for joining us, secretaries.
Nice to be with you.
Secretary Sebelius, what are the top things every company needs to do to get their workplace ready?
Well, I think that people need to plan and prepare. We know that the flu hasn't gone away. Seasonal flu vaccine is available right now, Gigi, so we'd like to start with encouraging employees to go get their seasonal flu shots and get that kind of out of the way, be ready to go. Hands and home are the two health tips for mitigation. Keep your hands clean. Wash them frequently. Use alcohol gels. And also cough into a sleeve, not your hands, will help. Keeping workplaces clean, making sure that you wipe down frequently areas where people use their hands a lot. And then go home and stay home if you're sick. Keep your child home if he or she is sick. 24 hours after the flu, fever is gone, is safe to come back to work or send your child back to school, but that really helps. We also have a priority group of individuals identified for when H1N1 vaccine becomes available about mid-October, and we'd love to work with the private employers, with the private sector, to get employees ready to be vaccinated. Pregnant women, older workers with underlying health conditions, young workers under the age of 24, particularly susceptible, and caregivers of infants. We don't recommend vaccinating a baby under 6 months old, but moms and dads, grandparents, foster parents need to be vaccinated to protect that baby, and certainly anyone in the healthcare field. So working with employers closely to help us get the message out that their employees may be at risk and that they should be ready to take advantage of the vaccine once it's available.
Okay, Secretary Locke, are you working on any economic scenarios if a severe outbreak hits? We're hearing that the shipments may be too little too late, maybe a hit to GDP or a derailment of the economy.
No, we're actually optimistic that the vaccines will be available. Not everybody's going to need a vaccine or can even get a vaccine all on the first day anyway. And so Secretary Sebelius can talk a little bit more about the supply of vaccines, but it's expected to be ready around the first part of October. But our message to employers is they got to get ready. They need to plan. They need to plan for absences of their employees, and if so, who's going to take over? So that means cross-training. That also means emphasizing to the employees, because it's in the economic interest of the company to send people home if they're sick and to make sure that their employees stay home. That also means coming up with flexible and perhaps more understanding personnel policies, not demanding, requiring a note from the doctor if a person is sick, or a note from the doctor saying that the child was sick and that's why the employee had to stay home. Because we don't want to burden the healthcare delivery system and doctors' offices who are trying to take care of the sick. And also being understanding with hourly employees, making sure that the hourly employees feel that they're welcome to go home and that there'll be a job waiting for them when the flu epidemic passes. Because if you try to replace your hourly workers, if they're sick, with new people, you might actually be bringing the infection back into your company. And it takes a long time to train and bring that new person up to speed. So focus on your personnel policies. Plan ahead of time, cross-train, so that other people can pick up the slack.
Okay, thank you, Secretary Sebelius and Secretary Locke. We're going to continue talking to you after a quick break, so thanks for sticking with us. We're back now with Health and Human Services Secretary Kathleen Sebelius and Commerce Secretary Gary Locke. Secretary Sebelius, there seems to be confusion out there over how crucial the public option is in terms of health care reform. Has the administration shifted its position on this?
I'm glad you asked, Gigi, and the answer really is no. I think this weekend must have been sort of slow news because actually I was saying exactly what I've been saying for months. Holding down costs and providing choices for consumers have always been elements that the president has supported, that I've supported, and we feel that the public option is probably the best way to provide cost control, somebody to compete with insurance companies and keep them honest, keep the rules straight, hold down costs, and then provide some consumer choice. So the public option is very much on the table. It's in the 4 bills that have been drafted so far. What isn't clear yet, and as you know, the Senate's on recess, is what exactly the Finance Committee will provide in their draft. But the public option is very alive and well. The president continues to support it as probably the best way to provide choice for consumers and cost control for the private insurance companies.
But how do you get health reform back on track? What's your plan when everyone returns from the recess in September?
Well, I think it is on track. 4 committees, 3 in the House and the Health Committee in the Senate, have drafted legislation. We're further down this road than has ever been done in history. I think we're poised to have bills that can pass both the House and the Senate. The Finance Committee, as you know, is working hard to keep the bill bipartisan, to keep the Republicans at the table, and hopefully that will continue, and a bill draft will come out of the Finance Committee in September. But, you know, we're poised to have a bill that can go through the House and the Senate, be resolved, and be on the president's desk this fall that provides comprehensive reform, controls costs, provides choices, and changes once and for all the rules for private insurers that let them pick and choose who in America gets coverage.
All right, and Secretary Locke, while we have you, the #1 question here at Bloomberg, there are glimmers of hope, signs of an economic recovery. What do you see for the next 6 months from your vantage point at the Commerce Department?
Well, we do see those glimmers of hope, and the free fall in the economy has stopped thanks to the heroic efforts of the President and the Congress in passing the stimulus, which provided tax cuts for middle Americans, assistance to the states so they could continue to provide vital services and not lay off teachers and law enforcement, and to provide that safety net of services for adults, vulnerable adults and children and seniors and the sick. And also stimulus money that's reviving the economy, getting people back to work, which is why businesses need to really focus on making sure that the H1N1 flu virus this coming fall does not get out of control and does not jeopardize that economic recovery. And that's why businesses need to plan. Start training more of their people, sending a message loud and clearly that if employees are sick, to go home and stay home, and have very supportive and flexible personnel policies so that people don't think that they have to come to work, otherwise they might lose their job. And for companies that want a toolkit of what to do and how to respond and how to prevent the epidemic within their ranks, within their walls, there's a toolkit put out by the federal government, and it's available online at www.flu.gov. That's flu.gov for this toolkit on how businesses can cope with and hopefully prevent and minimize the H1N1 flu this season.
We want to know real quick before you go how companies can prepare financially. Could a small business go under, for example, if a severe outbreak hits?
Well, to prepare financially, obviously, to have personnel policies in place, to start training people now, and to get the message out now in terms of telling people to constantly wash their hands, to cough and sneeze into their sleeves, to have regular cleaning of all workplaces that people might touch, and to emphasize teleconferencing and avoid face-to-face meetings and really using the phone.
Thank you so much for your time, Secretary Locke and Secretary Sebelius. Very helpful
Good to be
have
with
your
you.
insight.
Thank you.